welcome to this special show, or I should rather say, Sat Sri Akal, because we bring to you this special show from the state of Punjab, the land of the Sikhs, the warriors, the farmers, the fertile land, and the state that borders Pakistan. And what better place to start this episode than the holiest Sikh Gurdwara, the Golden Temple. Through this episode, we'll tell you the stories from Punjab, the new Punjab, its challenges, its struggle, and how it's coping to keep its spirits high. Punjab indeed has a drug problem, and far worse than India. While India is considered to be a rich country because of its youth population and the youngest population in the world, Punjab is showing the other side of this demographics, the glut that can plague the younger population, and that is drugs. Walking through the by-lanes in Punjab, every second house that you enter would at least have one addict, and that is taking away from the shine of this otherwise considered rich state. Punjab, the land of the warriors and of farmers who feed the rest of the nation. But now, Punjab is fighting its own battle, feeding its own hunger.
यहाँ पे हर दूसरा लड़का नशा कर रहा है और हर तीसरी लड़की.
In district Muktsar Sahib in Punjab's Malwa region, we reached village Bhangchadi. The name itself suggesting the cultural prevalence of narcotics in this region, and a village where every family has at least one drug user. Here we met the family of Sakka Singh, a 30-year-old addict who committed suicide 3 months ago.
नशा शराब शरूब वाली पींदे सी होर गोलियां वगैरह खांदे सी सारा कुछ खा लेंदे सी.
तो उन्होंने क्या आत्महत्या की?
हाँ.
Through dusty lanes lined with brick houses, the family took us to Sakka Singh's house, dilapidated and shut since his death. उनके परिवार में और कौन है? वो यहाँ पर कोई हमें मिला नहीं है.
कोई भी नहीं सी करे, सारे हैं नहीं सी करे.
Just next door lived Nayab Singh, whose 35-year-old son died last month because of overdose of an easily available pharmaceutical drug. He was a long-time drug user.
वो कहते भी मौत हुई है भी ज्यादा नशा करने कारण हुई. हाँ.
ज्यादा नशा की वजह से.
हाँ, खाके बक गोलियां लड़ी पड़ा गया. हर के बैठे ना.
70-year-old Nayab Singh says his son used to sell off household items to pay for his daily dose, and one day paid the price himself. Bhangchadi is a reflection of the horrors of a drug-abused Punjab. Statistics from a Punjab opioid dependent survey conducted by the All India Institute of Medical Sciences, supported by the State Department of Health in 2015, showed the ugly truth. 3.1% of Punjab's population uses opioid, and over 0.84% of the state's population is opioid dependent, which is 4 times more than the global average. Data from National Crime Records Bureau states suicides due to drug abuse or addiction, like that of Sakka Singh, made up 4% of all suicides in Punjab in 2014. For the country, this stood at 2.8%. The Punjab government claims the survey is exaggerated, but villagers tell us a different story.
Police government रोके तो फिर ही नशा रुकेगा. जब government आप तो बेची जाती तो बच्चा ने खाना ही. एडे बच्चे 15, 16 साल वाले भरे थे तो नशा मिलता तो नशा खाते है ना.
बच्चे भी.
हाँ.
Infiltration of opium and its derivatives from Pakistan in this border state has long been a problem, but poor enforcement has converted Punjab youth as its biggest consumer. The rate of heroin abuse among 15 to 25-year-olds in Punjab is as high as 73%.
The craving of heroin is just dying, ma'am. I would prefer dying being craving, ma'am.
This 20-year-old was studying to be a doctor. After 6 years of drug abuse, he is now recovering at a private de-addiction center in Muktsar Sahib town.
It was about 18 lakh.
3.5 years, you had spent about 18 lakh rupees only on drugs.
Mainly I'm getting about heroin only.
That's the economical brunt of drug abuse. Punjab Opioid Dependent Survey also estimated that almost 20 crore rupees of drugs were consumed on a daily basis in the state. Expanding menace of drugs has led the state of Punjab to a point of crisis as far as healthcare is concerned. Indiscriminate use of contaminated needles and syringes has brought the state to a point where infections like HIV and hepatitis C have become common household names.
कोई भी सिरिंज पड़ी होती थी ना, हमें मतलब कि पता नहीं होता क्या है क्या नहीं, हमें ये बस हमें नशा चाहिए, तो जो सिरिंज पड़ी होती थी उससे हम टीका लगा लेते थे.
And with this, the inevitable.
तो हमें काला पीलिया हो गया ऐसे, मतलब कि काफी मतलब कि घर से तबाही की है.
28-year-old Gaurav and his friend Sonu, both drug addicts, recount their horrors of sharing needles to inject heroin in their near-dead veins.
हम तो उसको 15-15 बार 20-20 बार लगाते रहे हैं एक ही सिरिंज को.
Almost 50% of opioid-dependent population in Punjab injects the deadly drug heroin or easily available opioid medication buprenorphine. Now infected with the deadly burden of hepatitis C, Gaurav and Sonu come to this opioid substitution therapy center in Swami Vivekanand De-Addiction Center in Amritsar city. But they are not alone. Over 600 active drug users come to this OST center, the Opioid Substitution Center, to get their daily dose of drug. These are still active drug users, but the attempt is to move them from intravenous drug use to orally taken, medically approved pharmaceutical drugs. And this is much needed because the statistics and data is damaging. According to a study conducted by the Swami Vivekanand De-Addiction Center in 2015, 38% of intravenous drug users contracted hepatitis C and 30% of IDUs contracted HIV infection. The Punjab Opioid Dependent Survey 2015 estimated nearly 75,000 IDUs in the state. However, state-level data on drug users contracting HIV and hepatitis C was not available. At the center, we met Bhagwan Singh, a peer group member of the National AIDS Control Organization's Needle Exchange Program. A former addict himself, Bhagwant now distributes clean syringes and condoms to his addict friends to promote safe use. But the Needle Exchange Program, which is globally recognized to help arrest spread of STDs and bloodborne infections in injecting drug users, has not been a true success in drug dens of Punjab.
The lower level, they are very, very scared. That किसी को पता चल जाएगा, arrest होके अंदर हो जाएंगे. So they are very scared to open it out that yes, we are on drugs. So not ready to admit it. So it was not possible for us.
चल के जाना पड़ेगा.
नहीं गाड़ी चली जाएगी, गाड़ी चल जाएगी.
We accompanied Bhagwant to one of his hotspots in the outskirts of Amritsar city. However, as anticipated, none of the users came forward openly. आप लोग अभी भी सुई से लेते हैं? हाँ?
जो चिट्टे वाइट वाला था, ये वाला करते थे सभी ये. अब खत्म हो गया वैसे, अब कम करते हैं वैसे, ये दवाई दूई खा रहे हैं आपकी.
Without the cameras, we heard real stories and we saw the true picture of drug-abused Punjab. Substances and opioid freely available. People, in fact, in front of us also came in motorbikes who were willing to supply drugs to people who wanted it. Charges 500 rupees for a small pack of heroin. It's that easily available in these small bylanes of Punjab. The amount of penetration of these drugs in these regions is much more than the penetration of clean syringes. But then there is a cost attached to it. Family budgets are fast depleting in trying to arrest this crisis. आपने कहा 90% लोगों को यहाँ पर हेपेटाइटिस है. आप सब यहाँ पे जितने लोग बैठे हैं इसमें सभी को इन्फेक्शन है.
इन्फेक्शन है, लीवर इन्फेक्शन.
The cruel reality of village Lande Rode in district Muktsar Sahib in Punjab. Killer virus of hepatitis C that infects the liver and spreads through contaminated blood runs through this village.
जो वीकनेस है ना, वीकनेस बहुत होती है जी.
Wrong injection practices and growing number of injectable drug users has made the disease so common in this region as if it was a family tradition. 55-year-old Jaswinder Kaur showed us her family's medical reports. 5 out of 9 in her family are living with this disease.
ऐसे जी 5 जी हैं घर में.
घर में 5 लोगों को है. टोटल कितने हैं? On the positive side, cost of treatment of hepatitis C has fallen drastically in the last months. Sofosbuvir, the miracle hepatitis C drug by Gilead Sciences, which sells at a retail price of $1,000 a pill in the US, sells at less than $10 in India after Gilead licensed 11 Indian companies to make generic versions. The price has come down further.
वो 15,000 रुपया जी 17 ਤੋਂ 19 इत्थों तक ना ट्रीटमेंट जेड़ा गोलियां दा चल रहा है.
But that still amounts to a cost of nearly 60,000 rupees for a 3-month treatment cycle, a sizable financial burden. In Jaswinder's case, treating all 5 affected members simply wasn't an option. Thus, only Jaswinder's son and daughter-in-law ended up receiving treatment last year, that too funded via a loan.
नहीं सकी इतनी दवाई इतना पैसा से कित्थों बनाएंगे. किसी सोचो ਅਸੀਂ 3 लोग नहीं ले सके.
वो पहले 19,000 का गोली आई डब्बी आई, फिर ਹੁਣ ਉਹ 16,000 का 15,000 का हो गया है. यही सोचते हैं कि और 6 महीने रुक जाएगा तो और कम हो जाएगा तो बचत हो जाएगी खर्चे की.
He sums it up very well. It's all about money. It's all about money, which is what is making this family, which is full of hepatitis C infected, prioritizing who they want to treat first. Lande Road has become an ideal sales ground for pharma companies. Some are even providing free hepatitis C diagnosis, direct supply of the medicine to patient families, as well as loan assistance to push up sales. But that has its own nuances. आपके परिवार पे भी कितना कर्जा होगा दवा की वजह से?
2 लाख रुपए इसका लिया
सिर्फ दवा के लिए?
हाँ, दवा लोन पूरा करने लग जाएंगे 2-3 साल तक लग जाएंगे.
जो दूसरे की दवाई है वो भी लोन पे ही करेंगे?
लोन पे करेंगे. हाँ, घर का पैसा तो है ही नहीं.
And then there are families who simply can't even afford a loan. Harvinder Singh lost his father to hepatitis C 3 months ago. He and his mother are also living with the disease and say there is nothing much that they can do.
ਥੋੜਾ ਘਣਾ ਉਹਨਾਂ ਡਿਸਕਾਊਂਟ ਆਇਆ ਇਹਨਾਂ ਦਾ. ਠੀਕ ਹੈ ਜੀ, ਹੁਣ ਪਤਾ ਤਾਂ ਕਰਦੇ ਆ ਪਰ ਫਿਰ ਵੀ ਪਹੁੰਚ ਤੋਂ ਬਾਹਰ ਆਈ ਕੀ ਕਰੀਏ. ਮੈਂ ਉਹਨੂੰ ਦੇਖਦੇ ਹਾਂ ਜੀ, ਹੁਣ ਮੰਨ ਲਓ ਫਸਲ ਚੰਗੀ ਲੱਗਦੀ ਆ ਤਾਂ ਕਰਵਾਉਣੇ ਆ ਜੀ, ਨਹੀਂ ਤਾਂ ਫਿਰ ਠੀਕ ਹੈ.
There may be some hope for such patients. The Punjab government has launched a hepatitis C relief fund last week with an aim to provide free treatment to patients. Drug firms like Mylan have signed up to be one of the core suppliers. Some have already snubbed the project as being nothing more than a political stunt ahead of assembly elections. But even if it is not that, access to medicines is only one of the many challenges confronting the drug-abused villages of Punjab.